Back today, we are talking with Daniel Tapanes. He's a coordinator of the Outpatient Youth Services here at the Loma University Medical Center. Appreciate you being here with us today.
Absolutely.
Now, you're the coordinator of the Outpatient Youth Services, but we're talking about the Adult MEND program because you do a lot here. Tell us about that program.
Well, interestingly enough, the MEND program started out in pediatrics.
Okay.
So the reason it's still under youth, or still under my direction, is because it kind of had those early origins.
Yeah.
So it's a biopsychosocial model that's kind of performed in an intensive outpatient setting, dealing with chronic illness in adults and their family systems, and the transition from active lives to more medically focused lives.
What are some examples of the types of people that you're working with to improve their lives?
It's a broad range. So we may have pre or post transplant individuals, heart, liver, kidney, things of that nature, sickle cell disease, all sorts of chronic anomalies, cancers, of course, oncologies, things of that nature, craniofacial.
And your goal is to take the person that's either gone through this program or is going through it right now. What's your goal to make their life better?
Oh, that's a complex question.
Yeah.
So, for us, our bodies are really just kind of like these emotional regulatory systems.
Yeah.
And that regulatory system has effects on physical health. So the emotionality within a system, you can imagine all the changes that happen with an individual who's struck with a chronic illness.
Yeah.
If it's during a developmental period, then it plays out differently than something that's a later onset. We have power differentials and changes and children. And so emotionally it's a struggle, and financially and socioeconomically it can be a struggle. So when we deal with the stress responses from the illness and the meanings that the illness generates, we can kind of lower some of the thresholds of the nervous system involvement, which suppresses the immune system, helps with medical compliance, cognition, makes transitions to different types of life easier, and actually bolsters the body's ability to fight and work with this new disease process.
Sounds like there's a lot involved.
Yeah.
How do you work with people? What's involved in that treatment?
Well,
to help them to get from point A to point B, it sounds like.
Yeah. It's a model that was designed here at Loma, and it's a 4-phase model. And the early part of it is what we call language learning. It's just understanding how the psychogenics, or the body's responses to stress and illness, happen. We learn that language, kind of teach it back to the patient, and then create changes within the system so that the meanings and the efforts that are generated are not causing these stress responses. And there's a lot of hormonal process and stress that are negative, physically and in health, and make things even more difficult. So that's kind of the beginnings of it.
Yeah.
Once they learn that language back and start creating the changes and normalizing those processes.
It's almost like it's like understanding, here are the stresses that you're dealing with, and you're helping them understand so that they can better accept the treatments and
Sure.
take the stresses off their body.
We have to weed out the physical presentations of strong emotional responses to the fear and worries about illness from the actual illness process itself.
Yeah. Wow. How long does the treatment program generally go? Generally,
we're looking at about 8 weeks. So 3 times a week, sometimes 2, depending upon their medical responsibilities, if they had dialysis or something.
Yeah.
Averages about 21 days.
Okay.
Of 21 treatment days.
21 treatment days.
So about 3 times a week for about 8 weeks.
Okay, which is not super long, but it can make a big difference in their treatment and in their quality of life and their prognosis there.
The outcomes, it's in research, and it has been, and we're moving towards NIH funding for further research, and the outcomes have been very, very strong.
Well, congratulations on that. Thank you. I appreciate it. It's Daniel Tapanes, coordinator again with the Outpatient Youth Services. If you want to find out more information, there's a website that people can go to find out, llubmc.org. We'll put the information on your screen there, llubmc.org. Thank you so much for being here with us today, and all the best with what you do. It's important work. Thank you. You're watching KESQ, the Desert's news leader. Stay tuned.